I was working for Steely Dan, and the bass player walked up to me with an older gentleman. I said, "Well, tell me what you've found out so far." He said, "They have diabetic neuropathy." And I said, "Well, how did this start?" He said, "It went from these two fingers here, and then it went around to the thumb." And I said, "You do not have diabetic neuropathy." And he looked at me and he said, "Excuse me, sir, but I've been at every top neurologist in the world. I'm a studio musician. I'm the keyboard player for Smokey Robinson, and I can't play piano anymore." So I took this seriously, and I said, "You want me to prove it to you?" And he said, "Yeah."
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. This podcast is one of the most important podcasts I may ever do because this podcast will impact generations of people following us today. Your kids, your grandkids, and their grandkids are going to be dealing with this conversation and learning from this if you just take a few moments and listen in. Today, our conversation is what is now a medical diagnosis called text neck. We have many names for this scenario, but before I get down there and get going too far, as you know, and I'm sure you're tired of it, I got to tell another farm story. See, I grew up in the Midwest on the farm, and living in the farm was a very physical life. I'm 61 right now, and I spent a lot of years doing a lot of physical labor. In fact, back in those days, and in my early years of practice, the number one health condition that typically came into a chiropractor's office or a physical therapy's office was lower back pain because life was very physical. A lot of lifting, a lot of bending, a lot of weights involved. And today, though, we are dealing with a whole different pandemic. We don't lift, we don't bend much, we don't work as hard. And this difference, though, over the time period of the last 30 years has created a new pandemic, a new epidemic. And I honestly know that this is not going to get better because of the ongoing onslaught of social media and the necessity to be sitting in front of a computer. Today, the heavy lifting is over, except if you consider an iPhone to be heavy lifting. We're born what has been called in a C-curve position, the fetal position. If you picture a small embryo, a small child, a fetus, they're inside the womb and they are humped over. Like often you see your kids today on the gaming devices. We are born with a C curve in our spine, but over the first 2 to 3 years, we will develop what we now call good posture. And this is what is called an S curve. You start to crawl and your lower back humps down instead of humping back. Your neck extends backwards and you start to develop two curves that are forward curves called the S curve. We have an S in your neck forward. We have a small backward curve in your middle back and a small forward curve in your lower back. This creates what is a S or a spring. You need that spring in your spine. If you don't have a spring, every pound of gravity, every impact you go through just wears out your joints, wears out your spine, and ultimately we're slowly turning back into that. And it's mostly because we are now all humped forward, head down, shoulders forward, hump back, reading emails, scrolling on social media, texting our friends, and gaming. Well, the results are headaches, neck pain, arm pain, all the way down up to seizures and thoracic outlet syndrome. How do you know if you're being impacted? Your kids are being impacted? What's the future going to look like for you? Well, here are the signs you need to be aware of. Are your hands falling asleep? Do your wrists bother you? Are you getting carpal tunnel syndrome, especially in both hands? Do your elbows bother you? Your shoulders sore? Are you losing strength in your arms or your hands or your shoulders? If you have bilateral anything, if you have both hands, both wrists, both elbows, both shoulders, and any capacity bothering you, you don't have a shoulder or a elbow or a wrist problem. You have an upper spine issue. You have what is the beginning and maybe even further of what is now termed text neck, computer spine, or in better words, it would be thoracic outlet syndrome. Basically, you're becoming the hunchback of Notre Dame. Well, to deal with that and to understand this, I'm not just talking about you, I'm talking about your kids, your grandkids, because this is not going away fast. We got away from living heavy things to humping over things all day long. Heads down, shoulders forward, and we are occluding the brachial plexus. Well, those are big words, but to help you understand what I mean by this, I have brought in the expert. Today our guest is Dr. James Stoxen. Dr. James Stoxen is a #1 international best-selling author. He wrote the book, The Human Spring Approach to Thoracic Outlet Syndrome. He's built one of the largest celebrity practices in the United States. He's treated world tour entertainers in over 140 national tours and with award-winning performers. He's also the editor-in-chief of the Journal of Orthopedic Science and Research and sits on the editorial boards of over 40 medical journals. Dr. Stoxen, so good to have you. Thanks for joining us today. Man, I see you and I see all. If you're not watching this, you should go online to see everything on the picture. Doc, what's behind you there? And welcome to the show. Fill us in.
Well, right over my shoulder are just a collection of backstage passes that were given that you have to get access to, to the entertainer. And on the other side is certificates of recognition for lecturing at medical conferences. Some of them don't give you a certificate, but it's nice to get it. Put it on your wall, looks nice.
Well, it's reasonably impressive for sure, but what's more impressive is the amount of things you've done and the amount of boards you sit on, the impact you've had throughout the world on a specific area, but I think it's more than just a specific area. Why don't you tell us a little bit about your book, why you wrote it, maybe just start off by how people can find it before we get going too far.
Well, of course, it's on Amazon, so it became a #1 bestseller in 9 countries in 2018. The condition is very rare, but it's becoming more common. At the time I wrote the book, there were 40,000 people per month Googling thoracic outlet syndrome. Today, there are 200 to 250,000 people Googling thoracic outlet syndrome. So it's become an epidemic. And as you had mentioned in your intro, it's mostly from the cell phone use and the computer use.
Yeah, this thing, I'm not joking when I said this podcast is one of the most important ones I may do, because whether this exists today at the level that I'm concerned about, it's soon to become a massive problem unless we inform people the impact, the understanding of not only what it's doing, but how to reverse it. So we're going to get to that today on this podcast. Dr. Stoxen is going to help us understand it, but he's also going to help you understand how to reverse it, how to treat it, how to resolve it, and not become another one of these statistics. But before we get down to that point, Doc, let's just define thoracic outlet syndrome, because I call it text neck, and it's really not by definition text neck. It's a bigger epidemic. Why don't you help us understand what the heck is thoracic outlet syndrome?
Well, people who have thoracic outlet syndrome think that's their only diagnosis. But in reality, you can have text neck, which is widespread neck pain, shoulder pain, pain between the shoulder blades, numbness, tingling, that type of thing. But thoracic outlet syndrome is another level much worse than text neck. When you have inflammation, there are nerves that warn your nervous system of this inflammation, like if you injury or if you've, overdid it. And the inflammation sends a message to the spinal cord, and the spinal cord says, must be an injury. And then it sends a message back to the muscles to brace the area. Like if you have a car accident, your neck barely moves, you have muscles that are stiff. So as that inflammation accumulates, it starts to actually contract these muscles to stabilize it so you don't move it too much. The problem is the more they contract, they're going to get tired. And when they get tired, you have muscle fiber damage that creates even more inflammation. So the first wave is when you have, like too much time on the computer. You got a 10-pound head, 9 to 12 pound is the amount of weight your head weighs. So you have this bowling ball hanging from your neck muscles while they're straining. That's the first wave of inflammation. The second wave is when those splinting and guarding muscles become damaged, and that's additional inflammation. So now the reflex is stronger, the messages are stronger to the spinal cord, and there are more of them. So it starts to spiral around, and it just gets worse and worse and worse. And that's how you get so much muscle tension that it actually takes the shoulder and it drags it down into this tunnel where the nerves and the blood vessels flow, and it compresses those and causes, lack of blood supply in the hand, which is cold hand, can turn purple, start to atrophy. You can't get the blood out, so that, the hand swells, and you have these nerve pains, mostly in these two fingers to start with. Okay. So that's when things get worse. And also, what makes it kind of scary is if you have enough compression on that tunnel and it narrows the vein, you could get a blood clot. And if you get a blood clot, it can release into your lungs, cause like a pulmonary emboli, and you can get an infarct, and yet you can actually die from it. So doctors take it pretty seriously, and they actually operate on this to open up a bigger hole so that blood can flow through that tunnel. But we like to do it differently. We can open up the tunnel without the surgery, and that's what the book is about, and that's my treatment approach that I developed.
Well, I have seen over the last 30 years a variation of those surgeries, and they are a bit barbaric. The first one I've seen is they start cutting open the carpal tunnel because their hands are numb and swollen, and they automatically go to that diagnosis. And you and I know that those are often wrong diagnoses, and those surgeries are very limited. They get about a 30% success ratio at best, and that's because 70% of those are the wrong diagnosis. It's coming from something above, at the elbow or at the shoulder or at the thoracic outlet. Then they go to the thoracic outlet surgery, and that's the most barbaric one I think I've seen in this area, where they just start cutting bones out of the way and they start removing muscles and tendons just to open this tunnel. And there's got to be a better way, and I think that's what you're telling us.
If you realize this, the source of what causes this reflex to spiral, to create that splinting and guarding, and the muscles are so strong, the contractions are so strong that they shift body parts where they don't belong. And that's where they get in the way of the blood flow. So it's the inflammation that actually causes the whole problem. So if you're focused on inflammation, moving it out as quickly as possible and thoroughly as possible, you'll have a good result. The problem is that doctors use muscle stimulation, stretching, even exercise, and unfortunately, that doesn't move that inflammation out. So the condition will stagnate. It might feel a little better after one treatment, but it just never goes away. So if you're not focusing, if your doctor is not providing care that focusing on removing that inflammation, you're never going to get better.
Well, I know a lot of people are wondering, how do we move this inflammation out? But I'm gonna have you hold off on that answer yet. I want them to grasp a little bit, because there's a lot of confusion on this diagnosis. I've seen it for many years. A lot of people get this, they say, I just got stress in my upper back or stress in my neck, or then they say I sleep wrong with my hands, or they have all these reasons why their hands, their arms, or neck are bad. How do people identify thoracic outlet? What are the symptoms of that versus maybe just stress, or maybe even all the way to carpal tunnel? How do they know the difference? Is there a difference?
Well, your tech neck, your chronic neck pain, chronic shoulder pain, that's a diagnosis in itself. When it becomes thoracic outlet syndrome is when the shoulder actually gets dragged down into the tunnel and chokes off the blood supply and nerve supply to the arm. Or when the rib actually lifts up into the tunnel and does the same thing, chokes off the blood supply and nerve supply. So when you have a cold hand, you're not getting enough oxygen and to that hand, and you're not having what we call cellular respiration, where oxygen is hitting the muscles, and because oxygen and nutrients actually provide nutrients, but 40% of what you get from the oxygen is used to keep the body warm. So the way we diagnose that, doctor, is that it's really a fascinating new innovation that we've come up with, which is called the FLIR camera. So you can buy a FLIR camera attachment for your iPhone at off of Amazon, and what it does is it's a forward looking infrared camera. So you can put it on your door to see if you're leaking warm cold air into your house. Yeah, you take it around looking at your home's inspection. Yeah, and also we had a special ops guy from North Carolina whose job is to, pretty much end the life of every adult male in the house. I mean, that was basically his job description. And he said, "Well, I've got one of those. I have it attached to my weapon, or my goggles." So they used them in the military as well. But what we used it for is we put it on the patient, and then we can see where the heat is and where it's not. And commonly, what you'll see with a thoracic outlet syndrome with the FLIR camera is you'll see like blue fingers or and red hand, and nice and white hot shoulder, neck, everything's hot. But you'll see maybe the whole hand is blue, maybe it's only on one side, maybe it's on both sides. And then when you do film that, you have evidence of this uh, you know heat change difference, and also it will measure the actual degree difference. Like we had a patient that came in, which was actually the special ops guy. He couldn't work, in the military because he couldn't pull the ripcord on the parachute. So when we put it on him, his hand was 71 degrees and his neck and shoulder area was 98.6. So he had almost a 27, 28 degree difference in the heat of his upper body and his hand. So the FLIR camera, is it like an attachment for an iPhone or Android? You can get it for around $220 on Amazon. Real easy to use, very simple, and it's an excellent home use diagnostic tool that not only you can check your blood supply of your hands and your feet, but you can also check your house for any leaks in air conditioning or heat.
Yeah.
Good for
Multi-use that other
inspections if
thing.
you're buying a house.
Oh, all right. Well, that's begging this question now, and I got to ask it because I'm always throwing rocks at some of the expenditure we've spent on medical technology. Oh my gosh, we have improved medical technology through the roof just as we continue to decline into the basement of chronic illness. The inverse relationship of that irony doesn't always hit people like it should. But this seems like a no-brainer. How many medical offices, orthopedic clinics, guys that are in the world of treating this thing are even using that technology?
Well, I had one here and I could have shown you. It's really not that big a deal. It's tied up similar as any kind of attachment for an iPhone just to get your microphone to work. That's about as big as it is.
Are these orthopedic guys using that? Because it's a no-brainer. It seems like you'd have that not only to help diagnose it, but to make sure you're treating it correctly. Because then those temperatures would just continue to rise. Correct?
Well, if you're treating it right, you're actually opening up the outlet, then the color change will be going from blue to
Right.
actually if you want, what we'll do is we'll give you an example of a before and after of a lady that came to us from upstate New York that had, a purple hand on the right and the left. And then her husband was standing next to her. He had both warm hands, so it was red. And then uh, after we treated her, the hand was red and, hot on the left because we treated the left side, but the hand on the right was still blue because we hadn't got to that side yet.
Okay, so obviously there's an easy way to help diagnose that. I was curious because when I deal with a lot of issues of brachial plexus neck issues, I know it affects certain fingers. Is thoracic outlet all fingers then?
I like to tell stories to get people to understand. I was working for Steely Dan, and the bass player walked up to me with an older gentleman. He said he wasn't able to take the top off the sushi soup because his hands didn't work anymore. They were kind of weak. He couldn't even open the door. It had progressed that badly. And I said, well, let me see if I can help you. Of course, the bass player went upstairs to play, and I was like kind of hoping I could go see Steely Dan, but he brought the gentleman down. I was going to put some time in here and had to help him. So, I said, well, tell me what you've found out so far. He said, well, I was at a neurologist's office. Every top neurologist in the world, he said, I have diabetic neuropathy. And I said, well, how did this start? He said, it went from these two fingers here, and then they did a ulnar nerve surgery, and then it didn't work. And then it went around to the thumb. And I said, you do not have diabetic neuropathy. And he looked at me and he said, excuse me, sir, but I've been at every top neurologist in the world. I'm a studio musician. I'm the keyboard player for Smokey Robinson, and I can't play piano anymore. So I took this seriously. And I said, you want me to prove it to you? And he said, yeah. And I laid him on the table, and I put the Vibasage on the muscles, the scaling area and the shoulder. He started screaming. And remember, we're backstage with all these muckety mucks, my arm, it's on fire. Like like when you wake up in
Yeah.
the morning and you lay it on your arm and you're tingling just so crazy in your hand. That's what he was experiencing, was the blood flow was finally coming back to his arm for the first time
He's
in
waking
5
up.
years. And I turned the machine off and I looked down at him. I said, Mr. Burke, make a fist for me. He went like, oh my God, he said, my hand is working again. And I said, wouldn't it do me a favor? He said, what? I said, don't scream fire in the theater. We'll have a stampede of people running out. Okay. So that's kind of a story, because diabetic neuropathy starts distal, because of circulation, and it comes proximal, But thoracic outlet syndrome, this is the 71 nerve root. So it starts at the bottom. And as that rib starts climbing up, it starts clipping off the nerves as it goes up. 7 or T1, 7, 6. 6 is these two, like this finger, see? So when I mapped out the way the syndrome progressed, I said, nah, it's not diabetic neuropathy. But you can imagine how, with the level of neurologists that he went to, you would think that they would know that. It's just, how many severe chronic pain cases, that's all I see. Like every week I have one patient, I treat one patient a week. You'd be shocked to see how badly the diagnostic component of a patient visit is. It's just shocking to see how poorly the people are diagnosed. And some have been to 8 or 10 doctors, and the diagnosis is wrong with every single one of them.
Every single one. And this doesn't shock me because I'm telling you, I've seen this forever. And it's what I said earlier, and I've been preaching now for this whole life of this podcast, is that we are chasing the wrong rabbits down the wrong holes, that these guys not even doing the right tests. And if they do, they may not pay attention or don't understand what to do because all they've trained on is how to find the right pharmaceutical for you versus thinking through the process. And I just want to revamp so people hear this is that first off, you got to get the right diagnosis. And if your hand is slowly deteriorating from the small finger towards the thumb, that is a classic indication, it sounds like, of a thoracic outlet. They get misdiagnosed, they get mistreated, they get blamed for ulnar neuropathy, diabetic neuropathy, and they're wrong. Half the time it's a lot simpler, and diabetic neuropathy is a great way for medications and treatment for the rest of their life. So I don't know, maybe there's not enough money in that for people to actually chase the thoracic outlet, because once you fix that correctly, don't you also just resolve a multitude of other health problems for a long time period?
You're absolutely right on that. And what I wanted to, yeah, I'm glad that you went this direction, because what we also know is that inflammation, which is the cause of this muscle splinting and guarding that's so severe, is also the cornerstone of aging. And we know that inflammation is the cause of the plaques that develop in the arteries, that narrow our arteries, that lead to heart attack and stroke. And as you know, you go to get your echocardiogram, you go get your diagnostic tests by the cardiologists, and they come back with this, your arteries are 95% blocked in your heart. Well, it's really something that people don't think about, is that you can't just have 95% blockage of only your heart arteries. You have to have
Exactly.
95% or a high percentage blockage of all your arteries of your
They're
body.
never checking those either. They're not testing all that stuff.
Imagine that you don't have good circulation to your kidneys. You don't have good circulation to your brain. You don't have good circulation to your liver, your legs. Why can't we run when we're 70 years old? Why do we shuffle our feet? Why are we so weak we can't walk up the stairs? When those arteries close up, they can't go and do balloon angioplasty or, stents on every single artery feed in your entire body. So what you have to do is you have to start early, recognize that, focusing on inflammation is the key to a number of disorders, including cancer, is linked to inflammation. And the book that I'm going to publish in January is where we see that inflammation can actually pass through the blood-brain barrier and through the inflammation of the gut, with the vagus nerve. It can actually move into the brain. And when the brain gets inflamed, there's an enzyme that's called that the enzyme that will recognize the high level of inflammation. And what that enzyme will do, it'll say, hey, wait a minute, there's something going wrong here. And so it says we need to make some of this kynurenine to calm this down. So it needs tryptophan for that. Well, we also need tryptophan for serotonin. And if we don't have that tryptophan, we're going to have depression. So it steals the tryptophan to make that serotonin, to calm down that inflammation. And when it gets really bad, like it keeps going, it turns into quinolinic acid. And then this quinolinic acid is like someone that works in your office that the littlest thing flips them out, like that crazy lady. Oh my God, turn the heat up, turn up the lights, So quinolinic acid sticks their key into these NMDA receptors and shines a bright light into the brain. And now you have anxiety. So that's why it's common for people with lots of inflammation, especially around the head and neck area, these thoracic outlet syndromes, these tech neck syndromes, to have the concomitant anxiety and depression. In fact, when I interview patients on the phone, I say, well, do you have anxiety and depression? Because they have severe inflammation. And they say, well, not really. And I tell them, look, if you don't have anxiety and depression with that much inflammation, I can't believe it. That's what is something rare. You should have anxiety and depression with this amount of inflammation. It's like this. If you give a person a fifth of alcohol and they drink the whole, fifth of alcohol, or let's say even half a fifth, you're going to be drunk. So if you give it to them and they say, I'm not drunk, look here, you know what? You just drank a half a fifth of alcohol. You should be drunk. So yeah, they're drunk. And intoxication of alcohol changes your moods, changes the way you think. You have your angry drunk, your depressed drunk, your calm drunk, all these different changes in the nervous system with the alcohol intoxication. Exactly like inflammation intoxication. So when you have inflammation intoxication, you have anxiety, you have depression, and you think it's a chemical imbalance, when in reality, it's just a high level of inflammation. And if you know that, if you're going to treat the inflammation, you're going to actually solve a lot of these tech neck problems and thoracic outlet syndrome problems and misdiagnosed carpal tunnel problems, pinched nerves. And at the same time, you'll have a better mood. And that's what we focus on with these patients, to actually change the intake form to include more inflammatory conditions like colitis and asthma and allergies that increase inflammation, autoimmune disorders, skin disorders that increase inflammation, to see if we can find the link to what is increasing this inflammation that is causing them to have these mood disorders, and then attack it with anti-inflammatory measures, whether it be avoidance of foods or attack the muscle inflammation to drop it as quickly as possible, but hit it from all different angles. And what we're seeing is many people are seeing a drastic change in their anxiety and depression levels.
Is chronic pain holding you back? At AFC, our team is committed to your well-being. We provide holistic care, including chiropractic, physical medicine, immunotherapy, detox programs, and more. Our experts target the root cause of your pain for lasting relief. Book your consultation online or by phone and experience our smooth process. AFC, embrace a life without pain.
That just got me thinking about a variation of problems. I probably don't have time to go through them all, but when you go back to the pandemic and how anxiety, depression went through the roof, and we blamed it on the fear of the virus, but I actually now think back, what everybody did for that year is they got on their phones, they got on their computers, they sat around eating crap probably, and we just set off this whole inflammatory cascade that had already built up a pretty good head of speed, and we just threw gas on the fire, and now we're just blaming the fear of all these public issues and stuff on anxiety. But you're saying, and I'm agreeing with you, it's just inflammation, and it's just a cascade of results from higher and higher level inflammation, which I don't think anyone's arguing that. We know 7 out of the top 10 diseases in America, and I think it's 8 now, the top 10 killers of Americans in disease are related to inflammation. So I don't think everyone's going to argue with us in what you said, but what they're going to go to, which I'm going to, so I'm now listening, because as a listener, how do you get rid of inflammation so well where others struggle?
Well, let's just say this, to your point, there's no argument. I'd like to have the listeners just type PubMed, PUBMED, into their computer. And there's a simple interface like a Google search. You just type inflammation, depression into the search. And what you're going to find is there are 17,500 studies that link inflammation to anxiety and depression. So it's really not, it's not like a chiropractic thing. If you type in inflammation, depression, Harvard University, you'll find 8 studies done by Harvard University that link inflammation strongly. It's got to the point where it's not even something to argue about anymore.
Yeah,
It's
yeah,
definitive. Okay.
right.
So the way we move the inflammation out quickly is our intake forms have all the inflammatory conditions that could increase inflammation, whether it be, you know, lung inflammation with allergies or seasonal allergies, or if you have, mold in your house, or, like skin inflammation, like dermatitis or psoriasis is a big one. Like almost half of the people with psoriasis have depression due to the massive inflammation of the skin. And if you look at, like musculoskeletal inflammation, I think musculoskeletal inflammation is number one because you store so much inflammation in these muscles. It's almost like if you have a clean glass of hot water, it's like clear, you can see through it. But if you put a tea bag in there, it's going to start diffusing. Simple diffusion will fill that entire glass of hot water. It's a cup of tea. Okay. So when you have these, like muscles, which are full of inflammation, they're like tea bags that are in your body, just, releasing this inflammation, just like releasing tea into the hot water. You have to find that inflammation. So our method of diagnosis is simple because the blood tests can't find that inflammation in the muscles. It's in the muscles, not in the blood. So the blood tests throw people off. What we do is something called inflammation mapping. It's fascinating new way of mapping where this inflammation is. It's very easy. We can either use the Vibasage, which is a large applicator pad attached to a low amplitude vibrating massager that can scan the body for areas of soreness. And you could just use your thumb to apply pressure to a muscle from origin to insertion, mapping the level of tenderness. Like, how's that right there? That's a 3. What's this one? That's a 4. What's this one? A 4. A 4. How about right here? That's a 9. That's a 9. This is a 9. This is a 9. So we map out the entire upper body if that's where the area is. We may go to the lower body, depending on how much you want to get done. And we map it out, and then we set up a game plan the next day, 9 a.m., to massage it out, the full body, with focus on the areas that are the most inflamed. And then we go through with hands-on treatment to literally push the inflammation out of the muscle into the interstitial fluid, which is the space between the skin and the muscle. Then we follow up with the Vibasage to pump it out of the area and massage plow that inflammation into the drainage ditches that takes it to the kidneys through the blood, and then you urinate it out of the body. So it's like rinse and repeat, just sessions of 3 hours at a time. 1 hour for the Vibasage to blast it out, 2 hours of deep tissue, then another hour of Vibasage, 2 hours of deep tissue, another hour of Vibasage, and then go back to the hotel and take a rest. See you tomorrow.
Wow, they go pass out, I got a feeling, after that.
Well, the only one that's passing out is me.
Okay, you got me there. It's probably got to feel fantastic. In fact, I'm just going to maybe sum up what I think I heard. Tell me if we got this muscle that's just muscles that are overworked, beat up, traumatized, posture deficits, humped over, bent over, stressed out, toxed out with food, toxed out with pollutants, environments, allergens. And every muscle, after that much trauma, toxins, and thoughts that have just been accumulating for years, we've got these tea bags that are just all murky. And your treatment, your approach is we're going to go just full out until we're going to filter out that water until it's clear again. And we're going to get what has made all those muscles inflamed, the murkiness. You're just going to go until you're clean. You figured out a way to filter the toxins almost out of the muscles. Is that what I'm getting? Am I close?
Absolutely. And the way we determine if we got it all out is we go back over that entire map of inflammation and we have all the numbers from the first visit. And then we press on the muscles and they just say, it doesn't hurt there. I don't feel anything. That's like maybe a 1, it's a 0. And you know what the next thing they say? Are you pressing as hard?
Right.
And you know what I tell them? I'm not that nice.
Yeah,
I
I've had
show
that
'em
conversation.
My thumb is white. It's pressing hard, I
Yeah.
can't press
Yeah.
any harder. I'll hurt myself, There's
How long does it take an average person to go from, again, this severe chronic pain syndrome, which is really what you're talking about? So if you're listening to this thing and think it doesn't apply to you, you're wrong, because I guarantee you, if you're the average American, you got some area in your body probably that's been in chronic pain, inflamed, and you can't get out of it, and you've just learned to live with it. Said, well, it's genetic. My dad had it. I got it. You're living with it. And what Dr. Stoxen's saying here is maybe not. That condition can be filtered out. How long would it take someone to go from, 0 to hero?
You got to remember that these people, I only treat severe chronic pain cases. I don't have office visits. Like, you can't call me up from 3 blocks away and say, I'd like to get an, exam and some adjustments. My practice doesn't work like that. We do a consult over the phone. They fill out an intake form. I do a pre-consultation report for them. We get on the phone again, and I figure out through the symptoms of the actual pain, the initial mapping of the amount of inflammation I have to move out. After doing this for 40 years, like you, Doc, you've been around for a long time. I know that a full-out thoracic outlet syndrome with all 10 muscles inflamed, it takes about 24 to 30 hours of deep tissue and vibromassage. The only thing you're going to do when you leave here after about 8 hours of treatment to move all this inflammation out fast is go back to the hotel and go to sleep. So then we come back the second day, we hit it again, and we're keep rinse and repeat. And then after about 4 days, they're doing great. Some of the side benefits are they sleep better. There's not a lot of inflammation soaking the nerves. You people taking 3 antidepressants, still depressed. 2 sleeping pills, still can't sleep. Well, you're not focusing on the inflammation. That's why they're not getting better. And so once you figure that out, doctor, and you focused on that, if you got a severe case, they're not going to get better with office visits. This is set up beautifully for these chronic pain cases when they can get a lot of inflammation mobilized out of the body within a very short period of time. Because you know why? They're coming from Sweden. They're coming from Bangkok. They're coming from New York. They're coming from North Carolina. They can't take a month and a half off to get 3 days a week treatment. They have to get it in within a week to get back to be at work.
Are you struggling losing weight? Do you need a metabolic reset? Are you concerned about diabetes? Hey, it's Dr. Wall here, and it's time to take action. It's time to get unplugged. Here's the simplest solution I've ever seen for losing weight. Reset your metabolism, reduce your A1C levels, and reverse your type 2 diabetes. It's time to feel great again. Hit the link in our show notes or go to drkevinwall.com and learn more about our Feel Great system. This product curbs appetite, reduces your cholesterol levels, increases your HDL levels, and supports normal blood glucose levels. It can increase your GLP levels by 70% when fasting. You don't need Ozempic. It's time to take control of your health again. Hit the link in our show notes and watch the belly fat melt off. You turn people around in 3 to 4 days, it sounds like. So that's the plan. That's the type of treatment that you do that gets these results.
Well, you don't have a choice because that's all you're given. Like when I work backstage, that's how it all started. Anthony Field had severe chronic pain and clinical depression. And I can talk about it without HIPAA law issues because he talked about it on television with his best-selling book. So it's all in the public domain.
Remind everybody who he is. He's the guy that started Wiggles, I think,
The
right?
Wiggles, yeah, the children's entertainers. And what had happened was I showed up. I heard he had all this chronic pain. And he said, just give me a crack before I go up on stage. Put your table next to the stage because I'll need a crack in the middle of the show, my back will go out on me. Then I'll get a crack after the show. And then before the second show, the matinee show. And then after that. And I looked at him and I said, I'm going to help you, but we're not going to do it like that. And he looked at me like he was going to throw me out of the backstage. Like, look, I'm the boss and we'll do it my way. And this is how it works. And I said, look, why don't we just get rid of this whole thing this weekend? And he looked at me crazy. And I said, you got pain on your right foot, your right knee, your right hip. Because I had analyzed his gait when he walked up to me. Go, how do you know that? I said, let me finish this. And so I put the Vibasage on him for like an hour and a half. And I did a total of 4 hours of treatment. And I purposely didn't crack him. I didn't give him the adjustment. Purposely. He got up and he was mad. He was not happy. I didn't give him the crack, which is what he wanted. It's what he hired me for. But he got up and he started doing some Elvis moves. And he said, my back pain is completely gone. How did you do that? I said, I restored your spring by releasing the inflammation. He goes, am I cured? I said, absolutely not. And we put 20 hours of work into his body, moving inflammation out in 2 days. And he hired me to treat all the tour. Every weekend I flew to like Tampa, I flew to Jacksonville, I went to Ohio, joined the tour, treated everybody, kept working on him. And then he was free from depression and anxiety for 13 years and chronic pain, in the best shape of his life. So if you want to learn about that story, you can buy his book. It's called How I Got My Wiggle Back.
All right. Well, Doc, we're going to run out of time here, and I don't want to miss one opportunity to give these listeners, first off, maybe 3 things they can do, which everyone wants to try to do things on their own. And so we will allow them to try. And then at the end of that, tell them how do they find somebody like you or you? How do they find treatment like you're providing? But let's start with the top 3 things anybody can do at home that maybe could help reverse chronic pain or thoracic outlet syndrome.
The first thing I would recommend is you have to focus on living in harmony with gravity. Gravity is pulling us down. And if you put your body parts in positions where it's not stacked, then you're going to have muscles contracting to hold those body parts like your 10-pound head, your 15-pound shoulder in that position for a long period of time. Muscle fatigue, muscle fiber damage, inflammation, no nerve reception, circuit to the spinal cord, back to the muscle, splinting, guarding. Those muscles get tired, more inflammation, stronger signals, more of them, more splinting and guarding, starts spiraling out of control. And then you have to see a doctor. Just stack the body and relax it. Also, good pair of shoes with a strong counter support keeps the heel perpendicular to earth. The whole lower body follows the heel. It's the heel. If you lay down and I take your heel and turn it, the whole leg will turn. So what we recommend is a shoe that has a stiff counter, like a Florsheim, or the other one is Drew makes a really good counter, or a powerlifting shoe, weightlifting shoe with a strong side to wrap that heel to keep it perpendicular will keep your legs, your feet from collapsing and causing a mechanical breakdown or meltdown from the floor up. when every step you take cranks out even more inflammation rather than making you healthy. So that's the first thing. The second thing, if it hurts, you can use vibrational massage tools, and we have one called the Vibasage. And would you like to
Can
see
they
that?
can they just go buy that online somewhere? Can they
Yeah.
get that from you?
Yeah, we actually have this. I have this one right here. Oops. And this one has a with the guns that the actual applicator pad is too small. Like if you're going to run and your legs are stiff and full of inflammation, could you imagine trying to move all that inflammation out of your legs with an applicator pad about as big as your thumb? It would take forever. So people just don't do it. And so this has got an applicator pad that's 5 inches. Plus, the skin on this is the actual texture of human skin. So this interface, the skin is the texture of human skin. On top of that, it's made by DuPont Corporation with some Stoxen material that it is used for wearables. So it has already been tested 10993 for long-term skin contact. That's why it's good for wearables. And this skin is flexible. It is almost the exact elasticity of human skin.
Okay, let me ask a question on that though, because I used to use vibration in treatment all the time, but patients always had a limitation of how long they take it before they start itching or it was uncomfortable or whatever. I assume maybe what you figured out on top of some of the frequency and the vibration is that pad. You say, does that allow this to patients to use it longer, doctors to use it longer and get that a benefit of rinse and repeat before the patient starts to kind of push back that it's bothering them? Is that true?
Well,
is that what that surface?
The problem with these interfaces is simple. The muscle has a hardness of 50 short A. We know what hardness of plastics are with a durometer. It measures the hardness of materials. So when we measure the hardness of this tabletop, it's 100. Golf ball is 90. Rubber tire is 65. Those massage guns, those rubber balls are 65. Then they have the softer ones, which are 35. But the problem is that muscle is around 50, skin is 30. So if we have an interface that had a softness of exactly 50, we will push it through the 30 hardness skin to rest directly on the surface of the muscle. And because the muscle and the muscle surface and the skin of the applicator pad are the same softness, same hardness, they can't injure each other. We've biomechanically, through biomimicry, matched the surface of the massage interface with the surface of the muscle. So there's reduction in potential inflammation. And that is why you can use it for a longer period of time.
If they're going to buy the Vibe, one more time, the Vibe massage,
Vibasage, yeah.
Vibasage, can they buy that online somewhere or where do they find that?
Then just go to teamdoctors.com.
All right. And that's also where they can find you if they want to find you or find somebody like you. Are there other doctors working with you in other parts of the country?
I'm going to be honest with you, doctor. I mean, really, nobody wants to do 8 hours of deep tissue a day.
Yeah, I get it. So you're not getting many people that'll do this, but you got a facility where they could come to you and stay for a week if they had to, it sounds like.
Well, they could come to me or we fly to them. There's prices for everything. You know, we have.
So teamdoctors.com is how they would find that.
Yeah. And drstoxen.com, STOXEN.com.
And one more time, the book that's been out is called
The Human Spring Approach to Thoracic Outlet Syndrome.
So they need to go read that. And then you have a new book coming out here soon. And what's that one going to be called?
It's going to be the Inflammation Depression Connection. But also, we have a course on thoracic outlet syndrome for those who can't, like the cost of coming to me for a week would be like getting breast implants, around 8,000, 7,500, 8,000. But it really amounts to $150 an hour, which is really a low amount. Okay.
It's crazy
not a
low.
lot.
You couldn't pay me, unfortunately, to do that, what you're talking about, for an hour.
No,
That's now we're back to that heavy lifting thing I started the podcast off. You're the guy on the farm still throwing the bales of hay. And God bless you, man, for doing that, because I understand that just needs to be done much more than we probably realize it needs to be done. We're going to wrap this thing up. And if you want to find more information on Dr. Stoxen, just go check our notes, go check our website. We'll have his information there online for you to find him, find his books, and to find more resources about that. But here's the thing I hope you get out of this podcast is that there is hope. Even if you're stuck in severe chronic pain, been told to live with it, and you can't get out of it, there's a chance you're misdiagnosed, you're getting the wrong treatment, and here's just proof that there are other ways to fix things that you've been told can't be resolved. So, all right, well, here you go. If you would do me a favor, share these podcasts with others, go follow us, go find us online, let other people know this is going on so we can get out to more and help people, because that's all we're doing. We're just trying to get information and solving problems that people are out there stuck in. So this is Dr. Wall and Dr. James Stoxen. We're checking out today from the Unplugged Healthcast. Come check us again on the next episode. Always remember, be healthy, be blessed, never give up, and never give in. We'll see you again on the next episode.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.